And what we're going to do is we are going to, and here's your icebreaker, so if you get your phones ready, just like scan it. I am going to ask you to introduce yourselves to each other. And imagine that you're going to be a team. And for our online listeners, you can't create a little team, but what I would like you to do is to imagine your dream team. Who would you love to work with for the next 3 years? So I'm going to give you about 2 minutes, and I would like you to introduce yourselves to each other, and then I want you to be really super, super creative. And if you're going to come up with a couple of names for yourself. You're going to come up with an identity for yourself. So what could that identity look like? Well, what about the superbug squashers? Okay, that's a cool name. Now, for one or two of you, I might even ask you to stand up and to call out your name, but most of them will come through on the Menti. And what is a superbug squasher? You might be going, okay, that could be your team kind of gesture. So starting right now, okay, I would like you to introduce each other. So 2 minutes, please. Okay, 2 minutes, and introduce yourselves to people around you and come up with your team name. I love this. AMR Kickers, One Health Warriors, Basque Sustainable Pharmacy, Love Peace AMR, Push-Pull Panel, the AMR Leaders, Awareness, Access Strong. Oh, look at you. Keep going. This is beautiful. Team names. Microbiology Masters, One Earth. All right, AMUVP Babylons, that would take some some explanation. Brotzi Proti, AMR. Can we just go up with the screen so we can see the new names? Can we scroll on the screen, please? Can we, to the team at the back, hi. Can we just scroll up a little bit so we can see some more of the names? There we go, look at that. Anti-AMR Squad, Super Public Fighters, the Bug Fighters. The Change Agents, oh, I love that. Aren't you, you're all change agents. Okay, super strong. All right, look at that, Super Gene Busters. Super Doctors, oh, okay, Super Doctors versus Super Bugs. Have you got a gesture? Let's see you. What would your kind of gesture be if you were, okay. AMR Bug Busters, love it. EU National Bug Fighters. Right. Okay, this is all looking really, really good. And I love the vibe in the room. It is, today we only have 2 keynote speakers. I'm going to cut my time short so that we have a slightly more relaxed day than we did yesterday. And I am going to invite our first speaker for today, Michele. Excepting for one thing, I don't think I see Michele here yet. So, oh, there you are. Okay, lovely. Okay. Michele from the OECD is going to introduce us to the economic impact of AMR. Thank you very much.
Thanks. Hello everyone, thanks for making it this morning, and I'm the guy with the bird now live. So in the next few minutes, I'm going to tell you a little bit the economic dimension of AMR. what OECD does, how can OECD help you in achieving the targets that you have set, and at the same time what OECD would like to receive and see out from this joint action. And I lead the work on public health at the OECD, by the way. So, September last year, countries around the world convened in New York and decided and agreed on targets to fight AMR, and they are now hopefully working to reach this target by 2030. The biggest target is certainly to reduce AMR-related deaths by 10% by 2030. There are also additional targets. All countries have national AMR action plans, and 60% of countries commit a budget. 9% of countries meet WHO's minimum infection prevention and control programs at national level. All countries report surveillance data on AMR and antimicrobial use. There must be a meaningful reduction in antimicrobial use in agri-food systems. Strengthen action to prevent, address the discharge of antimicrobials into the environment, and promote mechanisms to support research and development to address AMR. There are others, secondary targets that build on this one, but here we have set targets that for some countries are probably a little bit ambitious, for others are certainly within reach, and I think that the European Union member states, EEA countries more in general, should aim to make it for this target, and you are part of the magic to make it happen. So to inform this discussion and understand what should be priorities for countries, OECD supported and worked together with the quadripartite to understand what would be the return on investment of a package that is feasible and achievable globally. We calculated that we would need to invest $52 billion at purchasing power parity per year. Looks a very big number. It is probably much more affordable than we could think. We are talking about less than 0.5% of what countries currently spend on health globally. The priority areas for intervention include WASH, research and development for new antibiotics, infection prevention and control, and stewardship program. And if you want to see at the global level what is the share of how to spend this 52 billion, you have the pie chart on the right. So globally, for example, 26% of resources are probably needed on water, sanitation, and hygiene. Another relatively big part is on new antimicrobials and financial incentives and so on. The package will pay big dividends. This is a package that repays completely for itself and has a significant impact on the burden of AMR. We calculated that this package, if implemented systematically and globally, would help countries cover a lot of ground in achieving the targets. It's probably not sufficient, but it would cover a big share of the targets we wanted to achieve. The package generates a net return of approximately US $10 for every US dollar invested. We can say the same in euros. For every euro invested in the package, we would get back 10 euros in savings in healthcare expenditure and improved productivity due to a healthier workforce. On the top of these targets, European Union countries have agreed on a set of another set of targets that are compatible with those of UNGA, but to some extent go a little bit beyond. And this is the list. I'm aware that I'm probably already late, so I don't go into the details, but I'm sure that all of you know them very well. But beyond the target, we perfectly know that AMR causes a significant health economic burden on our countries. These are analyses that were co-funded by the European Union that OECD produced a little bit more than 1 year ago, and we calculated that across the UEA, AMR cost 6.6 billion euros in purchasing power parity to the health system and an additional 5.1 billion euros to our economies to the reduced productivity. We are talking across the EU-EEA of something in the order of magnitude of 24, 25 euros per capita per year due to AMR. Clearly, there is all the rationale, both health and economic, to take action to try to achieve these targets. We have a number of interventions that we can put in place. These are the interventions that OECD currently covers in its assessment, from promoting prudent use of antibiotics in humans, preventing the spread of resistant infection, promoting antimicrobial resistance, awareness and understanding, and then there are also One Health policies. And as we all perfectly know, there is much more that we need to do on policies outside the human health sector, both in terms of finding evidence, but also of implementing these policies, because the One Health component is key, is fundamental to fighting AMR. For that set of analysis, we looked at various combinations, and one that we thought is a good compromise in terms of comprehensiveness and impact is what we call the mixed intervention package, which includes the interventions that I've highlighted. Now, if countries implemented this package of intervention, that's what we would get. The cost would be in the order of a few tens of cents per capita per year across the EU, up to a couple of euros per capita per year in countries such as Norway, Ireland, and so on. But as you can see, the bar that the column that goes below zero is much, much higher than the implementation cost, that is what you have above the zero line. And this is due to savings in healthcare expenditure and productivity gains. To note that the package we have assessed for this analysis is slightly different from the one that was tested for the UN Assembly. But for this package, across European countries, still the return on investment is super good. We are talking about almost 6 euros of return of investment for any euro invested in the package. Again, is this package sufficient to reach the targets that were set after we calculated this package? This package would be extremely useful. It would help us covering ground. Probably is not sufficient on itself to achieve the targets. So what's going on next? And what will keep us at the OECD busy in the next couple of years? We'll update and extend the scope and the breadth of the analysis we carried out. We want to identify country-specific what is the most effective and cost-effective package to help each EU member state to reach the targets based on the current level of implementation of policies and the current expenditure on AMR. We want also to calculate what are the resources needed to invest into this package to make it happen. We'll also do a little bit of updates in our analysis. We thank the very close collaboration with the ECDC that makes us available the data to feed our model, and we'll also update the economic data, and I hope to receive a little bit also from you in this room. Finally, as I said, we produce country-specific analysis and outputs so that each country, based on the very specific situation of each country, would have a roadmap on how to achieve the targets. I have also some homework for you, and hopefully I will get a little bit of inputs in the next couple of years from you. I showed you a list of interventions. We know that the list is not necessarily comprehensive. There is much more than what that we can add. We would like to hear from you what are the priorities in terms of intervention to include into the package, also keeping in mind the availability of evidence to model this intervention. Second point. We work together with colleagues at WHO to get an assessment of the level of implementation of the policies. All EU member states implement a survey on the level of implementation of the policies. A more granular view of what's happening in specific policy areas would be extremely helpful. I don't know whether this is part of the plan of EU-JAMRAI, but receiving information on the level of implementation of the policies would help us in fine-tuning analysis and making them more useful for member countries. And then, of course, we are happy to listen to your requests and needs and try to identify ways to work together to achieve these targets. My last slide is to remind that the report that, as I said, is co-funded by the European Union is available on our website, and you can also find country-specific analysis and country notes that you can download for free. Thank you very much for your attention. I didn't see cards. I don't know whether it was good or whether you forgot, but here I am.
It wasn't good, it was amazing. Thank you very much, Michele. And I look forward now to welcoming our next keynote speaker, Emily. Emily is going to... Elena! I'm so sorry, Elena. Nothing better than getting the name wrong, huh? Elena, welcome.
Emily sounds good. So thank you to INSERM, l'Institut National de la Santé et de la Recherche Médicale, for their invitation to present our views on AMR. I represent today EPF, which stands for European Patients Forum. It's an amazing and unique umbrella organization that gathers more than 80 patient organizations. We are, we will be all patients one day, right? And more important than that is that we are related to an association in your country or at a European level. In Spain, for instance, here we have two umbrella organizations, El Foro Español de Pacientes, I'm so happy to be on their board, and Plataforma de Organización de Pacientes. So some countries have these representation at a very high level. So that's the title of the subject today, because we are very concerned about AMR. And we are going to tell you what we can do as the patient voice. So, as I said, EPF stands for European Patients Forum, more than 80 patient associations all over Europe. Some are a coalition, national coalition, and some are specific disease areas. So you may have dystonia Europe, or you may have hypertension Europe, and some platforms in their countries, in Poland, in Spain, for instance. So I would like to talk about AMR, how it affects patients' life. Over the past years, we had the opportunity to meet a variety of patients who have experienced AMR. I'm sure that you, maybe you not, but maybe siblings or people around you have suffered these problems. So we have patients with sepsis, kidney transplants, blood infections, cystic fibrosis, cancer, of course, urinary tract infections, etc. These interactions taught us that AMR can threaten anyone's life, and it can start with ordinary diseases or incidents, as illustrated by Rob's quote. To represent these patients affected by AMR, patient organizations can play an active role by raising awareness, by collaborating, like today, with healthcare professionals and others to implement best practices, improving patients' health, or advocating for enhanced policy action and equitable access to life-saving products. We have noticed among our members that many patient organizations are interested in AMR, but they do not know what to do. They do not have maybe this as a priority. So here we have worked at EPF how we can help our organizations to raise awareness about this. So one of the issues are the unstable financial environment for patient organizations, because it's more difficult for them to take on new topics in addition to their usual areas of interest. Conflicting priorities are more pressing issues, maybe affecting their community daily access to care. and the need for greater, more institutionalized involvement of patient organizations. There are other factors specific to AMR that explain patient organization limited engagement. That's why we are so pleased to work with you to help us how to communicate better all these resources. More specifically, the lack of capacity building program on MRR. So, for instance, we have developed high-quality materials and campaigns on MRF to improve health literacy. However, we need to intensify our efforts to effectively disseminate these materials and messages to ensure that they reach their target audience. The latest figures of ECDC show an increase of 1% in antibiotic consumption compared to 2019. So this shows the extent of the remaining work and the need for continued efforts to improve health literacy and understanding of AMR, its drivers and consequences. In this respect, we play a key role. As such, we would like to integrate in the development and implementation of national action plans against AMR. Our second priority is a greater involvement of patient organizations in awareness raising campaigns on AMR. We can support campaigns by bringing real-life experience, nothing better than share your personal story. We know that the power of the patient voice that impressed our decision makers and that makes and allow a change. We can collect patients' feedback about the relevance of certain campaigns, relaying with public authorities and adapting the messages to a therapeutic area. This is especially true today as AMR impacts several disease areas. For instance, as meningitis is concerned, and I'm here as a survivor and here with my hat of Vice President of Asociación Española contra la Meningitis, vaccination is crucial, is important to lower antibiotic use. If you get an infectious disease caused by a bacteria, nothing can provide you better than vaccines or, at the end, an antibiotic use. So MRR development against the first-line antibiotic use to treat bacterial meningitis, which is the most serious form of meningitis. And finally, I would like to talk about our younger group. We are working with the younger generation, and for several reasons, because we are seeing a decline in certain infection prevention and control measures among our young people. And for instance, ECDC reports a significant increase in certain sexually transmitted diseases prone to AMR. We believe in the need to raise awareness to foster the lifelong responsible use of antibiotics. These young people will become future doctors, pharmacists, researchers, and health literate citizens of tomorrow. We would like to build on the experience acquired through our youth group and our skill training course for young patient advocates. We want to create and disseminate youth-friendly social media communication to raise awareness on AMR. It has been a pleasure to represent our views, to present our work on this important subject and our priorities to unlock patient engagement, ensuring that patient organizations can participate fully in awareness-raising activities. I think this ties in with the next session, raising global awareness of AMR in Europe, which I'm looking forward to. Thank you so much for your attention.
Thank you very much.